That's indeed sad, heart-wrenching. He needs help, and your donations will ensure he gets it. Now to COVID-19, experts always note that there's still much to discover about the coronavirus. But one thing we've heard many times over is that minors hardly get infected. Now, when it was said that a 2-year-old girl with COVID-19 was being managed at the Federal Medical Center in Abeokuta, Ogun State, Taiwo Adeniyi, on behalf of Newsline, ventured near the isolation center to verify the claim. Here's what they found.
Noticed that she had high temperature and almost convulsing. I rushed her to a clinic, and after treatment, we were referred to Federal Medical Center.
That is Mrs. Oyele Yoruwatoyin, mother of the 2.5-year-old girl diagnosed with COVID-19 in Abeokuta. On arrival, the hospital management observed she had persistent high temperature and difficulty in breathing. Although the initial suspicion was meningitis, further investigations and tests revealed she was COVID-19 positive. She was immediately isolated, while the facility where she was initially admitted was decontaminated.
It's a lesson to everybody that anybody can be infected. So this 2.5 years old, and the usual thinking is that, younger ones cannot be infected.
Doctors managing the young girl are happy about her steady progress.
We are making progress because with sore throat, she will not be able to eat well, but she's eating well. So definitely we are winning.
Without putting on an ideal PPE, this is the safest point that medical experts managing this isolation center say I can stay in order for me to do this piece to come. But in the isolation unit, you have the first pediatric patient of COVID-19 to be managed by the Federal Medical Center, Abeokuta. Probably, in a matter of days, our result will come back negative twice, and she will be discharged. Meanwhile, not less than 8 members of staff of the hospital have tested positive to coronavirus. A statement by the head Public Relations and Information, Segun Orishajo, revealed that those affected include some doctors and nurses. The medical director, Professor Adewale Musalomu, said although none of the staff was symptomatic, they have been asked to proceed on self-isolation, and basic treatment commenced for them while wishing them quick recovery. Professor Musa Olomo reiterated his earlier assurances about the safety of the center, both for the workers and patients. So far, the Federal Medical Center Abeokuta has managed about 20 COVID-19 patients.
She will be fine. Still on that, available studies imply that the lines connecting coronavirus with children are somewhat blurry, while safety campaigns tend to